Postpartum depression and anxiety can make you feel like you're drowning and like the waves are so high over your head you can't even call out for help. If this sounds like you have come to the right place. There are a lot of people out there who are trained to help. This video will go over how to find those people and what you can start doing in the meantime to feel better, including a very simple over-the-counter supplement that you may have overlooked. Welcome back to Every Mama's Midwife. If you're new, my name is Jess. I'm a certified nurse midwife and infertility mom. I gave birth to baby August about 11 months ago. I really struggled with postpartum anxiety after both of my births, and it was a lot worse this time around, which really caught me off guard. As a healthcare provider, I knew what resources were available, but I still had a really hard time getting in with a mental health provider, so I'd like to talk about that first and then cover what over-the-counter supplements might be helpful. And just so we're on the same page, yes, I am a big advocate for medication for postpartum mood support. I know that's not very crunchy of me. Please don't take away my Birkenstocks. But if you have a genuine postpartum mood disturbance and you're having thoughts that maybe you would be better off dead, a walk outside and some fresh air is not going to cut it. There are chemical and hormonal shifts happening in your brain that you have absolutely no control over, and sometimes you need heroic medicine to function, and that is okay. You did not do anything wrong and you deserve to feel good. You certainly don't have to take medication, but if you're having a hard enough time that you are seeking help, it can be a life-saving tool in your toolkit. The best place to start is usually with the provider that helped you give birth. Whether it was an OBGYN, a certified nurse midwife, or a family practice physician, they are all qualified to diagnose and start treatment for both postpartum anxiety or depression. If you specifically want to see a mental health provider, they can help you figure out how to find one. If you saw a licensed midwife or other type of home birth midwife, they may not be qualified to prescribe medication, so in that case, it's usually a good idea to start with your primary care provider. If you are open to medication, there are a lot of options out there that can be really effective for both postpartum depression and anxiety. The most well-studied medication for postpartum depression is called Sertraline. It's also known as Zoloft, which is an ssri or a selective serotonin reuptake inhibitor. We know it's safe for breastfeeding mothers to take, so for most healthcare providers, that's our first-line medication. It doesn't work for everyone, and it can come with the super unpleasant side effect of making it difficult to orgasm, but fortunately, you do not have to stay on it forever. If SSRIs have not worked for you in the past, don't fret because there are a lot of other medications out there besides Sertraline. I'm not going to go over every single medication in this video. I'll leave that task to your healthcare provider, but as someone who has personally not responded well to SSRIs in the past, I was able to find a good medication combination that worked for me. It did take a few months of trying different medications and adjusting the dosages, but I finally feel like myself again. If you're a breastfeeding mother, there are a lot of medications that are compatible with breastfeeding. I actually read a really great study recently about how when it comes to mood medications and breastfeeding, overall, it is generally better to have a mentally stable mama, and that tends to outweigh any of the risks to baby when it comes to breastfeeding and medication use. If your OBGYN or primary care provider has tried a few medications and you haven't figured out what has worked, you probably will need to see a psychiatrist or a psych mental health nurse practitioner. Unfortunately, it can be nearly impossible to get in with a psychiatrist. I had my primary care provider refer me to a psychiatrist, and it took them 4 weeks to tell me that their practice was full and they were not accepting any more patients. I felt pretty lost and I was about to give up. However, my primary care said, I don't really have any other medications to offer you. And she really pushed me to continue to try to find someone. And fortunately, mercifully, I was able to find a really great psych mental health NP on the website joinlavender.com. So I'll put a link to that website in the description. It's a telehealth service that's available in many states, and they work with a lot of different insurances. I had an appointment with my mental health provider within 5 days of me searching on their website. Talk therapy is not always covered by insurance, so it's a good idea to call your insurance and ask if there are any in-network providers and what services are covered. I've had a few patients have good luck with finding a therapist at betterhelp.com. Finally, if you want to try over-the-counter methods first, a frequently overlooked vitamin that you may not be getting enough of is vitamin D. We know from research that vitamin D supports our mood and that breastfeeding moms need more of it. I recommend that my breastfeeding patients get at least 4,000 international units of vitamin D3 daily, and I can guarantee you there is not anywhere near that much in your prenatal or postnatal vitamin. In addition to the vitamin D, 400 milligrams of magnesium citrate at bedtime can help with sleep, and a B complex in the morning can help with energy levels. I think whatever generic store brand of vitamin D and the B complex are fine. I do have an affiliate link in the description to my favorite magnesium. If you are struggling right now, please know that you are not alone. Postpartum depression and anxiety can feel really isolating, but there are people who care about you and there are people who want to help. If you are having any immediate thoughts about harming yourself, please reach out to someone. If you need immediate help or support, you can call or text Postpartum Support International at 1-800-944-4773. Please take care of you. You are the only mama your kiddos have. One final housekeeping thing. Now that I am feeling better and want to start making videos again, what do you guys want to see? Other postpartum topics I've been thinking about are choosing to vaccinate your child or not, attachment parenting. I've also seen a lot of interesting things about parasite cleanses and beef liver supplements. So let me know in the comments what interests you the most. Please give this video a thumbs up if you found it helpful. Thank you so much for watching.